Hello, everyone. Can anyone hear me from WITN?
Yes, you can begin.
All right, thank you. So I want to welcome everyone to this month's Health, Aging, and Disabilities Committee meeting. Today is Wednesday, June 24th. Today we have 3 items on the agenda. We're going to have a presentation by Christiana Care. They're going to discuss racial disparities and COVID-19. We're going to talk about a resolution in defense of Black lives and commitment to enacting policies that defend Black life and aim to undo the effects of systemic racism. We're going to have a discussion on body cameras. But before we get started, I would like to allow everyone to introduce themselves. First, I am Ernest Congo, chair of the committee.
Michelle Hurley, representing 4th District.
Rashima Dixon at large.
Linda, Councilwoman Linda Gray, can you hear us? Or Councilwoman Yolanda McCoy, can you hear us? I think you're both muted.
Councilman Congo, did you hear me?
Yes.
Okay, thanks.
Councilwoman McCoy, can you hear us? Councilwoman Gray? Council staff, can you introduce yourself, please?
Hi, I'm muted. Hi, Andrea Queen, Deputy Clerk, Admin.
All right, thank you.
Marshall Bass Knight, Chief of Staff for Council.
All right, Councilwoman McCoy, did you want to introduce yourself? Councilwoman Gray, can you hear us? All right, they may be having some technical difficulties. Just want to thank everyone who has joined us this afternoon. Who is going to speak to the first item on our agenda? The presentation from Christiana Care. Who's here to speak to that?
My name is Dr. Roy Hex, and I appreciate the invitation. I was invited by Ms. Dixon to talk about our analyses so far on racial and ethnic differences, outcomes of COVID-19. Very quickly, by way of introduction, I am the chair of the Department of Medicine at Christiana Care. I am also the physician leader for our Value Institute, which is the Health Systems Embedded Research Institute. Most relevant, I think, to this conversation is that I'm the Chief Medical Officer for Wilmington Hospital. And so I'll focus much of my discussion on what I believe to be the intentions of the meeting, which is to discuss more specific data related to Wilmington, the approach to data that we have in terms of examining it at Christiana Care, and do so hopefully succinctly, and if aligned with the order of these meetings, usually allow time for questions.
Okay, just before you get started, I want to thank Councilwoman Rashima Dixon for coordinating the effort to have you join us today also. So thank you, Councilwoman Dixon.
Thank you, Councilman Congo.
So it was my understanding from the councilwoman that it'd be helpful to present a broad overview. So I'll be fairly succinct and allow much time for discussion, hopefully. You know, as in just about now, every bit of published data from throughout the United States, we've come to identify patterns of racial and ethnic disparity in both the presence of COVID-19 in terms of the rates of diagnosis, with minority groups being more likely once tested to have COVID-19 when compared to whites, as well as some differences in outcomes. As people at this council meeting are probably aware, throughout the country, we see disproportionately higher rates of mortality for COVID-19 among Hispanic communities, largely in border states and southern states. And we find within many urban settings, like the city of Chicago, for instance, that African Americans have a significantly higher rate of mortality from COVID-19. Nationwide, the statistics are that just shy of 70% of patients who die are underrepresented, being Black or Hispanic when compared to whites, despite not representing obviously 70% of the population at large. So COVID-19 has had a differential impact in terms of health and well-being, and we could perhaps talk about why that may exist. But as we look specifically at the state of Delaware, early in the course of this disease, there actually wasn't a great deal of data based on race and ethnicity. And it was early in the month of April that we noted that while testing was still in its early phases in Delaware, the majority of those tests had been processed at Christiana Care. And as we looked at the earliest data, representing the majority of testing in the state, again, in the month of April, the majority of that testing was done in Newcastle County. At that point, very little testing had been done in Kennett or Sussex. We were able, as a result of being the lab that processed most of the tests at that time, to begin looking at race and ethnicity, because as part of the screening protocol, testing protocol, we actually had those data available. As you're all aware, the data weren't publicly reported for race and ethnicity at that time. And we found that despite having about a rate of 14% positivity for COVID-19 overall, there were significant gaps where people who were designated as being non-Hispanic white had a positive rate of about 11%. And it was about 20% among patients who were designated as Black, so nearly twice as high. And when we calculated it statistically, it was a 70% higher odds of being tested positive for COVID for Black compared to white. Since then, we've seen an expansion of testing, and that early preliminary data led us to do some work to look at areas, which I'll describe momentarily, where we think the underlying rates of COVID positivity are going to be higher. And we noted that those things tended to align with poor socioeconomic communities, and again, communities that were disproportionately minority. As we began to examine patterns of positivity in our labs, more testing was being done throughout the state in the lower counties. And as data were being gathered from Kent and Sussex County, we saw some persistent patterns coming into the month of June, where we found that citizens of Hispanic ethnicity who report that they're of Hispanic ethnicity had significantly higher rates. In some counties, 8 to 9 times the positive rate of COVID-19 when compared to non-Hispanic whites. And in other areas throughout the state, the rate for Blacks compared to non-Hispanic whites was 5 times as high. This pattern of disparity between in positive rates, again, that's among people tested, what's the likelihood you're positive, persist no matter which of the 3 counties you examine. In Newcastle County, Kent, and particularly in Sussex, as of June, the data are all pointing toward Hispanics having the greatest rate of positivity when compared to the population at large. Blacks, the 2nd highest rate. And then a significantly lower rate are for whites across the state. So that's the global picture of positivity across the state. I'll talk to you a little bit about testing and the impact of that data on how we administer tests. So as we began to look at differences by race and ethnicity, we also began to look at the proportion of tests that were being done within given communities. The benefit we had in the months of April and May, when overwhelmingly the testing was being processed through Christiana Cares labs, was that we also had very discrete data. We had information about exact addresses where people lived who received testing. And as a result, we were able, through geocoding or geospatial analyses, to take a look at those areas where people who got tested were more likely to be positive. We were able to map those areas out, compare those to the zip codes, the neighborhoods, actually, a much more discrete level of analysis where testing occurred, and compare the two. And that resulted in the following conclusions. If you were to look at the statewide reporting, you would see that there's a higher rate of testing among non-Hispanic Blacks when compared to whites in Newcastle County and throughout the state. But compared to the likelihood of having disease based on the much higher rates of infection of positive diagnoses for these groups, when you look neighborhood by neighborhood, the suggestion was that we likely, despite having higher testing rates in perhaps COVID hotspots, we're still not testing enough. In other words, the disparity in the rate of COVID positivity was so high in certain neighborhoods, and there were 2 in particular in the city of Wilmington, where we found this to be an issue. That despite having a disproportionately higher number of tests done in those communities, we were probably still under testing relative to communities that had a lower prevalence of disease. So,
Excuse me, Doc.
yes, sir.
I do have a couple questions, but before that, I would like to recognize a couple council members who have joined us. Let's see, Councilman Cyril Adams at large, I think he's with us. Councilwoman Linda Gray, Councilwoman Yolanda McCoy, and Councilman Vash Turner. They have all joined us.
Thank you, Mr. Chairman. Thank you very much.
Thank you, Mr. Chair.
Dr. Hicks, are you allowed to tell us which neighborhoods those are that were recognized?
Yes, and in fact, the data are ever evolving, so I didn't submit it to the committee because we're routinely having a look at this. As you can imagine, each day that testing occurs, the data change. But initially, the areas in Wilmington, now this was again done about mid-April or so, where Reach Riverside was an area, the Riverside community, that was where we suspect that there was a hot spot where we got a lot of positive values, and it seemed as if the testing wasn't enough to keep up with it. And the second area was Southbridge, where despite the number of tests that were done, there being slightly higher than one would have modeled initially, the rate of positivity was so high. And so those 2 communities in particular seem to be what we called testing cold spots. In other words, where you would want to go and do disproportionately more testing because of the high positive rates.
Okay. Do we a couple council members do have questions. Do we know why those neighborhoods
Yes, and if you don't mind, I'll hold on answering that question until I
Okay.
talk a little bit more about disease transmission and what we're seeing with rates now, if
Okay.
that's okay.
Oh, sure. And then we
And
have, go ahead, I'm sorry.
oh, no, that's okay. And a little bit about what we're finding with our own internal data.
Okay. Councilwoman Harley has a question from the 4th District.
Yes, thank you, Mr. Chair. And thank you for joining us and sharing your data. As I shared earlier, I represent the 4th Councilmatic District and Southbridge is in the 4th District. I know that they have had some testing done at Henrietta Johnson Center. So I guess my first question is this: the data that you're sharing with us is as of what date? And I guess what I'm trying to understand is, was this prior to the testing that they've had over there recently, or is this data you're sharing afterwards?
Yes, Councilman. So the data, the specific, those 2 neighborhoods I mentioned as cold zones were in the first run of data. That was before you started seeing most of the mobile testing that was being done, including the efforts that started at Henrietta Johnson. In the Riverside community, we actually developed our testing strategy based on the numbers I gave you, right? And we shared that data not only with entities within Christiana that began standing up resources at a Kingswood Community Center, I believe, but others here may know better, twice a week, but with our partners in the community, as well as with the Newcastle County Commissioner, who has utilized these data to help with the Newcastle County testing strategy, and began sharing our data with the Department of Public Health. Although I can't speak to how those data were utilized to determine their testing strategy. That's out of my purview. What I will tell you is that for those labs that have been processed at Christiana, Councilwoman Harley, we continue to run the data. We do a run every couple of weeks to see whether or not the differences in zones have gone away. And I can't give you the specific, when you look at geospatial mapping, it sort of points to how intense the effort is. And the intensity has definitely picked up. What I can tell you is, as of the last run of data, it looks like more testing would still be beneficial in those same communities. Because again, the more testing we do, the more positives we're finding, and the rates continue to be disproportionately high, despite the increase in testing.
One last follow-up, Mr. Chair.
Yes, go ahead.
Okay. So, Dr. Hicks is your name, Dr.
Yes,
Hicks? Yes. So, so part of the spike you feel has a lot to do with the fact that there's more testing?
The controversial question, and I will tell you hardly, in my opinion, but I'm going to give you the disclosure of my opinion as a physician, okay? And solely my opinion.
Okay.
Anytime, so as you do more testing, you expect to pick up more cases. That is absolutely true. So yes, it is common sense that as you test more, you will get more positives return. However, what is concerning about COVID-19, unlike other diseases, for instance, if we were to massively increase screening for a type of cancer, breast cancer, mammography, that's a perfect example, right? You would find that as you expand testing, the positivity rate among the general population, right, begins to drop, right? Because you're now catching all the people that have it, but it's not rapidly spreading, certainly, and the denominator gets bigger, the number of cases slowly grows, and the total rate declines. If you look at what's progressed in our state, while the numbers of positivity, the rate of positivity has certainly changed, particularly given the efforts that that many of you have taken to socially distance and help flatten the curve, it hasn't fallen precipitously like you might expect. as we massively test more. And that still suggests that within these communities, there's actual spread. The second reason I wouldn't say that it's just due to increased testing is that if you look at the number of new cases, you're going to find that while, again, the trajectory over 90 days has gone in the right direction, you're not finding more than a 3-day period. And I would say that's 3 days is probably more than what you'll actually see. It's typically 2 to 3 days max, where you have a decline in new cases before you see another jump. So you have a seesaw pattern if you look at the statewide data over time. And if you look at Wilmington specifically, I don't know that there's been more than 3 days where you've had a decline in cases at all, consecutive days since the onset, which also suggests that this is not just a testing issue, that there continues to be spread within the community. Did I answer your question, Councilwoman?
Yes, you did, Dr. Hicks. Thank you.
And Dr. Hicks, I would also like to allow Councilwoman Linda Gray from the first district. She has a question.
Sure.
Thank you, Chairman. My question kind of overlaps. Since there has been a real effort and push to test in the hot areas or lower socioeconomic areas, and you're not testing as much in other areas, how do you know that the spread of the disease isn't more equitable? That's what I'm saying, because the people in some areas have better health care, they take better care, they don't have as many underlying conditions that would make them more ill or show symptoms. So how do we know it's not really prevalent in the other communities where the testing isn't going as intense?
Yeah, so to be very, very clear about the utilization of data, we're not pooling resources and doing diminishing testing in other areas, right? So it's a matter of equity of testing based on the likelihood of disease. So if you follow every couple of weeks, what you'll find is that we continue to test broadly throughout the state. We are certainly limited, as is every state in the nation, in terms of the number of tests we have available compared to the numbers that we'd like to do today. But I will tell you that testing is happening. It is happening in Hockessin still. It is not preferentially being done just in poor communities. But as you continue to evaluate the rate of return of positive cases compared to the number of tests that are being done, we'll still see a higher rate occurring in communities like Southbridge and in communities like Riverside. So we feel pretty confident.
Just didn't want you to think I was questioning the equity of the testing. No, that wasn't. I was just wondering, since maybe not as many people in one community would come out to be tested or not offered as frequently, how do you know that there aren't as many people positive there as in the communities that are having more opportunity or more concerned, or we're pushing them more to get out there?
Yeah, no, I think that, yes, ma'am, that's a valid point.
Because they've had testing in my community twice, and both times I went and there was no one else there.
Yeah, yeah.
They said that they had a couple people in the morning, but by 11 o'clock it had dropped off. Excuse me, dropped off, and that was pretty much the end. So, I mean, yes, it's available, but I don't think they're, the people in these communities may not be using it as much.
Yes, ma'am, and that is very likely true. And I don't know and can't provide you with full data that alludes to that. There are data that have been circulated, and again, there are now multiple entities doing testing. I can speak to some of what's occurring with Newcastle County as part of their testing strategy. And I can tell you that as they've examined the availability of automobiles, for instance, and they've looked at transportation indices and seen how difficult it is in certain neighborhoods to have transportation, you've noticed that there are lower rates of turnout for testing. And I think that goes to your point.
Thank you.
Sure. So as we've taken a look at the data, I pointed to some broad disparities that exist. In Wilmington specifically, since I'm speaking to this body, again, the data are quite concerning in terms of the rates of infection. So in Wilmington, and I'll pull up the data here momentarily. If you were to look at each group of people by race and ethnicity, and you look at it in terms of the population estimates per 10,000 individuals, as of yesterday, the rate of infection per 10,000 whites in the city of Wilmington is 38.5. So, and that is lower than the citywide estimate of 97 cases per 10,000 people, substantially lower. The reason that the citywide rate is so much higher than the rate just for whites is because of the disproportionate, again, burden among Blacks and Latinos. So when compared to whites, where it was 38.5 per 10,000, the rates for Blacks is 95 per 10,000, nearly triple the rate among whites. And shockingly, for people who self-designated as Hispanic ethnicity, it's 173 per 10,000. So, you know, more than 5 times the rate of whites. And that gap here in the city of Wilmington is sort of representative of what you see city by city and county by county throughout the state. The question was asked as to why, and that's if you know the epidemiology of the disease without treatment or a cure, and disease severity plays into the outcomes, but not the transmission of the disease. It is typically for the reasons that minority populations are at higher risk of having it transmitted. Disproportionately, we know that self-designated Hispanics and non-Hispanic Blacks compared to whites are people who work in the essential services. It includes people who work in healthcare settings, certainly, particularly, you know, everything from patient transport to a physician like myself, but also in the grocery stores, Uber drivers, restaurants, in the kitchens, et cetera, et cetera. And as we've implemented measures to reduce the spread of COVID-19, essential employees continue to work. And this has really been an issue with transmission, particularly in Suffolk County, as many people are aware. So that's the first answer to the question about why. The second reason is that historically, even if you go back to the Spanish flu, in environments where there are a larger density within the household, more people living in smaller square footage, you find increasing rates of transmission of highly contagious diseases. And it has happened throughout the course of human history. If you look at disease transmission, COVID-19 is no exception. More densely populated, smaller households, more spread, more essential workers exposed, more spread of disease. Those are things that are consistent epidemic after epidemic. There are other hypotheses that are floating about. If you look at the literature, and there's a lot of literature coming around, there's very little data that clearly suggests differences in adherence to things like mask wearing. So I can't point to that as a cause because those data don't exist. But most certainly, again, how frequently you're in contact with people because of a result of your job, and the closeness of contact you have because of the environment in which you live are probably the 2 greatest contributors to the spread. In addition to having differences in getting the disease, there are also differences in rates of hospitalization. Again, just with the Christiana data, we have found that among people who were tested, whose labs were processed at Christiana, the odds of ending up hospitalized once diagnosed were greater if you were Black compared to if you were white. The data aren't as clear for Hispanic patients because of some data collection issues. I apologize for the phone ringing in the background. So it appears that in the city of Wilmington and throughout the state, if you are Hispanic, significantly higher rates of disease transmission if you're Black compared to whites. If you're a Black, much higher rates between Blacks and whites of getting the disease, higher rates of hospitalization if you're Black. We have not found with our data that there are racial differences in mortality. And I've seen that data have been presented that suggests that actually the rate of mortality is lower for Blacks compared to whites, but I would issue one caveat, and with that I'll stop talking. It's that as we examine mortality data for the state, and if any of you have been watching, we periodically go back and look at deaths to determine whether or not we've appropriately attributed them to COVID-19. Over half of the people who have died in the state of data, Delaware did not have good racial and ethnic data available surrounding death from COVID-19. So the sample of our total deaths for whom we got good racial and ethnic data is lower, which makes it hard to do the comparisons. That's the first issue. The greater issue is that we know that the majority of deaths that have occurred in the state have occurred in nursing homes and among elderly populations. And again, nationally, people over the age of 70 are at increased risk, 75 significantly increased risk. And so you would expect that age plays a role. Well, life expectancy is significantly different based on race and ethnicity as well in this country and in Delaware. And we've yet to examine with age standardization, if you were to compare someone who is of the same age, whether they're Black, white, or Hispanic, who has COVID-19, whether or not there are differences in the rate of mortality. We're in the process of examining those data now to determine how much of the difference we see in mortality as an effect of age or being present from a nursing home, and how much of this may be due to some of the disparity, the patterns of disparity we have observed otherwise. So with that, I'll stop. I can respond to any specific questions people have about data or in general about COVID-19.
Yes, Doc. A few minutes ago, you mentioned something about the wearing of masks. Do you remember what you referred to?
We can't hear you, Councilman Kondo.
Okay, can you hear me?
Yes,
I can
we
hear you now,
Hear
sir.
you now.
Okay, thank you. A few minutes ago, you mentioned the wearing of masks. Can you go back to that? And then after that, then the Councilwoman Gray has a question.
Yes, sir. Over time, we have learned much more about the role of barrier protection, face wearing masks or shields has in preventing the spread of disease. And while initially in the month of March through early April, there was some sense that only in high risk settings was it necessary. Now the data are very clear after a few months that the greatest benefit we have, in addition to hand hygiene and physical distancing in reducing the rate of spread, is by barrier protection. So it is critically important in terms of curbing the spread of this disease. Not only must we avoid large settings, but wearing masks over the nose and the mouth have been shown to reduce the spread of COVID-19. And there are a few anecdotes where it's been very clear. So throughout the country, as states began to reopen, potential hotspots included the opening of beauty salons and barbershops. And there were a couple of cases where beauticians were coming to work with COVID symptoms or COVID diagnosis. This occurred in a couple of states. And there was significant transmission of disease, but for one, I believe it's a Great Clips, it was some commercial store, some chain, where there were two workers, two beauticians who had the disease, but routinely utilized the barrier protection. And they had great records for tracking every client that came in, and they found actually that there was no spread of infection as they did their contract trace and contact tracing from that. And people believe that the use of the masks that cover both the nose and the mouth significantly contributed to it. Several weeks in now to many of the protests that have occurred in response to the killings that you'll talk about later. What we're finding is that despite having masses of people involved in protests, looking across epicenters nationally, we're not seeing an uptick, we think, attributable to the protests. Again, the hypothesis is that it's because the majority of people have been wearing masks. Where we are seeing substantial uptake in many states, we're not seeing the same patterns of wearing mask protection in public settings like restaurants, in parks, and on the boardwalks. So it is important, I think, to emphasize, if we're focused on healthcare disparity, the importance of persistently wearing masks outside of your home for the communities at risk.
Okay, I think Councilwoman Gray.
Thank you, Chair. My question is about COVID going forward. I've been hearing more and more conversations about this is the new normal. And I think that a lot of people think that we're going to go back to what used to be normal. And I'm wondering, when are we going to start introducing and discussing with the population that they should be getting accustomed to doing what you're telling us to do? In other words, not to be in crowds, to wear a mask all the time, you know, sort of shorten your trips, don't make every outing a party. And in fact, there was one doctor that said he was born during the time of rheumatoid, what was the fever that they had back in the 40s? And he remembers rheumatic fever. And he was saying that he remembered that they changed their whole lifestyle. The family would go out together and they wouldn't go to large gatherings. So I'm just wondering, when are we going to start introducing our population to these concepts and ideas?
Thank you for asking that. That is the question of the day, Councilwoman Gray. I appreciate your asking the question. And what you're hearing is likely correct. All of the nation's experts in epidemiology and infectious disease, this is not really controversial. There is a belief that we will have another resurgence, and by resurgence, we don't mean it goes away completely and comes back. We mean that we'll have another rapid rate of spread that will occur in the fall. Between now and then, there is a belief that it will be what we call endemic, meaning that it will be a disease that lives within the community between now and the next quote unquote surge. So yes, people will be living with it. In terms of how long people will be living with it, the models differ. The group that is most frequently cited is now predicting that this will be persistent even with early successes in testing vaccine, easily for another 16 months beyond now. And so I think you're right. It is important to message to our communities that COVID-19 will be endemic. It will be here. And there will be at some point a surge. Hopefully it will come later rather than sooner. And much of that's dictated by behavior. In terms of the messaging, I can speak for Christiana Care. We have moved toward, through our several endeavors in working with the community, working with both primarily Spanish-speaking communities through at least 2 broadcasts and some engagement with community organizations, and with the Black community, leveraging our partnerships through the Value Institute and Harrington Trust, with houses of worship, and with barbershops and salons, areas we thought were real assets in the Black community. Working on education about COVID as an endemic state and the engineering that needs to be done within spaces as they reopen. Very recently, we've held trainings where we talked about living with COVID-19 and what you have to do for barbershops and salon owners, and even administered kits to help protect both the people who work in the salons and potentially their clients about re-engineering space. I think it would be beneficial to have those kind of conversations for other businesses, and as we think about schools reopening, for instance, in the city of Wilmington, having some very clear conversations about how to protect ourselves, understanding that there is going to be an endemic rate of disease. I hope I answered your question, Councilwoman.
Thank you. Yes, you did. Thank you.
Yes, Doc, I have a question. Why, can you explain why the resurgence will happen, it's predicted it's going to happen in the fall? Like, what's that whole process? How does that work?
So if I heard you correctly, Councilman, I think you were asking why would it get worse again in the fall? Did I hear you correctly?
Yes.
Yeah. So this is much of our modeling is based on. So modeling is a bit like predicting the weather, right? You're basing it on patterns that you've experienced before, and what you're seeing in the areas adjacent to you, right? And so if you look at what's occurred internationally in those countries, that Italy, throughout Asia, other areas in Europe, that predated our current surge by having a surge over the course of the winter. Months later, they're starting to see their second peak. And you examine the human behaviors that were associated with that and the timing, just by mapping out the timing, it seems as if the next peak would begin to arrive in the fall, again, based on that pattern. The other thing is you look historically. So you've heard people talking about the Spanish flu from 1918. And there was a phenomena there, they called it a W curve, where you saw disease transmission in the early spring, the rate of disease begin to fall into the spring, a lower level of disease through the summer. That's what we call the endemic state. And then another peak arise, and that peak began in the fall. And so when you compare that to what we've seen internationally, the two patterns match. So that's why you're hearing people like Dr. Fauci and others say very definitively we'll have another surge. It's a high level of confidence, although again, it's all prediction. Sometimes we're wrong with predicting the weather as well. But it's very, very likely. And we're also seeing, again, across now 22 states, I believe, increases steadily day after day. And actually, and I believe 3 states are now at peak number of new cases per day, despite having initially flattened the curve. So it may not be until the fall, sir, that we get a resurgence. It could even be before then, depending on our behaviors between now and throughout the summer.
Okay. All right. Thank you, Dr. Hicks. Councilwoman Gray has another question for you.
Thank you. I just wanted to also point out that I'm very discouraged that people aren't focusing on individuals staying healthy. Because I don't know if it's true, I've heard that they have determined that people that contract COVID-19, certain populations have worse symptoms than others. Of course, people have underlying conditions, but just how healthy you are, your weight, just anything that will keep you healthy. And I don't hear that being stressed either, for people to try to stay as healthy as possible during this endemic.
Yes, ma'am. I think that the major focus is obviously, and I would argue appropriately, been on reducing the spread of disease, right? Anyone, even if a healthy individual gets it, they may not get sick, but depending on the model you see, they can pass it to 6 to 11 individuals. And I would say, before I delve into the healthy part, again, even if someone is very, very healthy and asymptomatic and they get it, they can themselves become a vector of disease, right? So we've been really focusing more on the spread. To your point, health does matter. In our data that we examined, it's pretty consistent with what's been reported in journals broadly. When you are overweight, when your BMI is greater than 30, you're at significantly higher rate of mortality from COVID-19. Underlying conditions, cardiovascular disease increases your rate of mortality, but it's not just cardiovascular disease in terms of heart failure, which obviously is associated. Underlying diagnosis, hypertension, which is also disproportionately higher in the Black community when compared to whites, confers a greater risk of mortality. So I agree with you. It's really important to also emphasize to keep your blood pressure under control, to that maintaining a healthy weight, lowering your BMI to below 30, both reduce the likelihood that you would suffer hospitalization or death due to COVID-19.
Thank you.
Sure.
All right, Councilwoman Rashima Dixon has a question for you, Dr. Hicks.
Thank you again, Dr. Hicks, for taking the invitation to be with us today. I think in some cases, especially, is a little bit more concerning to me now. I'm hearing that there's more spikes pretty much every 3 days in the city, especially as we talk about schools reopening and other different activities happening in the city again. I'm wondering to a certain degree, what should we do what advice, I guess, in some cases, would you give to us as things are starting to reopen? And because what we've seen, and I think like you said, other states have the same arena as far as trying to reopen because of the economy and the fact that folks need to be working and bring in an income, and that we have 41 million people in the United States that are unemployed currently, that trying to get it back on track as far as money goes, because money in the United States makes the world go around, right? And rent still needs to be paid and all these other things. So people are anxious to get back out and to do and to work. We also know Black and brown people are mostly the ones on the front line who typically are the essential workers. So I'm just thinking about how could us in the city take a better approach as we start to think about activities in the summer. We know some things have gone virtual. Like I know Kingswood is not doing anything this summer. Everything is virtual based on they're having a high percentage in Riverside area. And I think Williams said that there were 25% of their people had COVID from who they tested in that area. So he's pretty much shut down everything for the summer. Is that something that we should continue to compete on? Or is there some halters and some things of how we should move forward?
It's a great question, Councilwoman. First, it's good to talk to you again. I would, one caution about the statement that there were current spikes every 3 days. I just want to be careful with the terminology. All the things that I'm giving you that are statewide data and city data are publicly available. We have not publicly released our internal data from Christiana that I described. But if anyone would like to take a deeper dive at the publicly available data, it's in the My Healthy Communities website. And they actually you can go to your specific zip code, you can go to your city, you can look at the county and look at those statistics. When you look at the maps, you can look at it in running averages and also new diagnoses and hospitalizations. And what you'll find, if you look in the city of Wilmington and in Newcastle County and in the state, over the course of the last 14 days, you'll see a pattern where there are more positive tests, fewer and fewer positive tests than more positive tests. And you do see this happen so that there really isn't more than a 2 to 3 day period where you have a decline in positive tests before you have another jump. And it's just persistent. But again, globally, if you look at that curve over 90 days, it's definitely has been on the downtrend with just now these bumps every few days. Going back to Councilwoman Gray's point, it's because we're going to be living with COVID-19. It's here and it's not completely eradicated. In terms of my suggestion for people in Wilmington and understanding that things are reopening, we can reopen, but try to be conscious of the risks that we pose to others if we are not wearing masks. I will say very plainly that it is head scratching that anyone would work or be in public without wearing face coverings. It is a threat not only to that individual, but to others who surround them, even if they feel like they are negative or have been tested negative. It doesn't make sense. So I would advocate as people return to work, the broad use of barrier protection, covering both the nose and mouth. And I think that's essential. The other thing I would suggest is not congregating in large spaces. And I know that the governor is recommending that. That is very true. The more densely populated, as we talked about, settings are geographically confined settings. more people in them, the higher the rate of transmission. I think everyone has heard about the 17 kids who shared a house, for senior week. And as ridiculous as I would think that is as a parent, it happened. And it's no surprise that so many kids that have ventured down there now have COVID positivity. So maintaining physical distancing as we reopen is important. I would think that businesses would want to engineer their space to try to address the human factors, people drifting into old behaviors, as Councilwoman Gray pointed out. We want to maximize spacing between tables, spacing between individuals in line. Everyone should be wearing a face covering. Largely, I would also say that disease transmission is less likely to occur in open spaces outdoors than it is indoors. So as much as we can move congregations to outdoors, where the spread of disease is thought to be lower, and there's some good data suggesting that. That's one reason we think that the protests haven't led to the surge that people once hypothesized. That would be better. So outdoors better than indoors, small crowds, physical distancing apart from one another, use of barrier protection and face masks, and frequent washing of hands for at least 20 seconds. And if people are using Purell or another product, alcohol-based solution, 30 seconds of vigorous hand rubbing. I think those are the things that keep people largely safe.
Thank you.
All right, thank you. I also like to recognize Councilman at Large Sam Guy has joined us. We do have a few questions from council members. First, we have Councilwoman from the 6th District, Councilwoman McCoy.
Thank you, Chair. Dr. Hicks, my question is earlier predictions. Are you able to hear me?
I can hear you. Yes, ma'am.
It seems the early predictions were we were trying to flatten the curve, and it was all about making certain that we didn't overrun the hospitals. And so it seems as though we didn't have as many hospitalizations as first thought. So just as we were preparing for like this spike, in the spread, in your opinion, will we have like the same amount or more when it comes to hospitalizations? This is something that we still need to be concerned about.
I remain concerned about what will happen in the late fall and ahead into the winter. I think that the reason things didn't get bad, nearly as bad as initial projections, we at the Value Institute worked with the same model. You hear most discuss what's called the CHIME model from the University of Pennsylvania. And you're right, across the state, we saw less utilization of all the resources than we predicted. That's an excellent thing. And I think it's because of the quick action that was taken to close schools, impose stay-at-home orders, and Delaware did declare a state of emergency, and I think appropriately so in good time, and so it's helped. And I think that moving into the fall, we really can affect how bad the next curve gets. It's going to be a matter of human behavior, in addition to climate, but that's not the part we can control. We can control the human behaviors. And I would say that the key to not over-consuming our healthcare resources is by taking the wise measures. People actually know what to do. The wise measures we just described, and identifying trends. I would offer for those of you with political clout a couple of suggestions, things that we haven't discussed that will also help. There's a principle called syndromic surveillance, which is where if you can gather data broadly about development of symptoms and clusters of possible symptoms early in the course of a disease in a community, you could say, wow, there are 10 people who suddenly have appeared at Hospital A in the emergency room complaining of a lack of smell and a cough. 2 weeks ago, there were none. There may be a new cluster of infections occurring there. Let's go there and test, right? So that's called syndromic surveillance. Many states across this country, because of our response to COVID-19, have been ill prepared to do that, understanding that a wave is likely coming in the fall. It'd be wise to think about ways to arm ourselves to do that. And the second is having adequate resources for contact tracing. Which is obviously essential. And I know the state has taken that very seriously. that's the other key. Once someone is identified and quarantined, it's accurately gathering data about who may have been exposed. There's a third thing that I passionately would speak to, which is availability of healthcare resources. A large difference in terms of how someone will do with COVID-19. Yes, it's their underlying disease, whether or not they have heart disease or obese, but it's also the accessibility of healthcare and the availability of providers who, on a routine basis, while someone has disease, particularly as they get to 7 or 8 days of infection, where people tend to get much worse if they're going to get worse. Having someone with whom you can discuss your symptoms, just checking in with you, is important. Most healthcare facilities have moved rapidly to establish virtual means of working with people who are homebound with COVID-19 and not hospitalized. But given the enormous disparity we see between Hispanic and non-Hispanic communities, obviously with Hispanic communities having a disproportionate number of people who are non-native English speakers, or speak Spanish as a primary language, making sure that our telemedicine capabilities are appropriate for people who have language proficiency differences, and for other special populations like the disabled populations, adults who have conditions that developed in childhood, like cerebral palsy, for instance, who may be living in residential homes. We need to make sure that for those very at-risk populations, we've adjusted the way we deliver healthcare so that they have the same kind of monitoring that everyone else has.
Okay, thank you, Dr. X. We also have a question from Councilwoman Linda Gray.
All right, I have another question. Can you address antibodies, and if there are any antibody tests out that you think are worth paying for? And then the other question is, I returned to my sort of personal, but I think it'll benefit everyone. I returned to my gym, and they have the machines spaced, and they have enough sanitizing spray and paper towels and everything, but almost no one was wearing masks except me. Everybody had them around their chin and on their arms. So what I'm asking is, do you think that I'm protected because I'm wearing my mask if I distance, okay? Or is this, am I putting myself at risk because I'm a high risk individual to begin with?
My response is not the official response of Christiana Care. It is Roy Hex's response when I tell you that you may be the only person who wasn't behaving foolishly that day at the gym. People should be wearing a mask, again, in public, regardless of the circumstances. Obviously, you cannot wear a mask while swimming. You do not want to, suppress your ability to breathe. But people should wear a mask and wear it correctly over the nose and mouth. And in terms of the risk conferred, you having a mask is far better than you not. Optimally, in an interaction with 2 individuals, the best protection is afforded by having 2 masks. Because there are people, again, some, it depends on the estimate, according to the most recent numbers from the CDC, 4 out of 10 people who were diagnosed with COVID-19 at the time of testing did not yet have symptoms. It's unclear whether they were asymptomatic or pre-symptomatic. So someone could feel like they don't have it, right? 15% of the time, depending on the assay, I'll get to the antibody test in a minute, you could actually be tested negative and we know actually have the disease, right? Because some of the assays have an 85% sensitivity. In other words, 15% false negative rate.
False negatives, yeah.
So someone could feel like they don't have COVID and not wear a mask. If they were to wear a mask, they're reducing the likelihood that their drops, their respiratory droplets that are microscopic, get beyond that mask and infect you. You are also protected for the few droplets that get around. 2 masks, always better than 1. 1 mask, better than none. At least you're barrier protecting to reduce the likelihood, if you're not infected, of droplets hitting you. So I would say,
concerned, do you think I'm putting myself really at risk since they're not wearing masks?
I personally would not be going to the gym where a bunch of people aren't wearing masks.
Okay, thank you.
In terms of my personal response. And I would advocate
advocate.
the ownership
It's
they make people
I'm
wear
going to put them
masks.
out there. It's the why. So I'm
Yeah.
definitely going to address them.
They should be wearing masks. And then to the antibody testing, again, it's my personal opinion and not the view of Christiana Care. Right now, there are two issues with antibody testing. Both lead me to say no, it's not ready for prime time, and I wouldn't lean upon that primarily. The first is what I refer to, which is the false negative rate, and we still struggle to find antibody test assays that we feel comfortable with in terms of their sensitivity. The second is once someone has antibodies to disease, that they've developed them. These antibodies we're discovering now can persist for a very long time. So when someone tests positive, for instance, and then the disease is gone and they're no longer infectious, if they were to be tested, you may still find antibodies there. We're now seeing case reports 3 months out where antibodies exist. So it's hard to tell the course of disease. So given the lack of confidence in its sensitivity, and the lack of confidence in what we call its specificity, we don't recommend doing those antibody tests, Rob.
Thank you very much.
Yes, ma'am.
All right, Dr. Hicks, Councilman at Large Sam Guy has a question for you. Sam, Councilman Guy, please unmute your phone, your mic. We can't hear you, Councilman Guy. I can't hear you.
I still can't hear you, sir.
No, we can't hear you, Councilman Guy.
Can he see us? I'm waving at him, telling him no.
Councilman Guy, if you can unmute your phone.
Is his volume up?
We're still unable to hear you, Councilman Guy.
If there's a chat feature, sir, I'm happy to respond to any questions in the chat.
No, but give WIT, are you able to send a message to Councilman Guy?
Yes, I've sent a message.
Okay, thank you. Okay, well, Councilman Guy.
Think you have it. Sam?
No, not yet.
Hear us? Can you hear me, Sam? Oh, he can hear me. We can't hear you.
You may have to log in and log back out.
Yeah. Councilman Guy, if you can hear us, you might want to try to log in, log out, and then log back in. That might work.
He's there. I think he's there.
I still can't hear him. I'm not sure if anybody else can.
He has actually typed in something in the chat room.
Dr. Hicks, I do have a question while Councilman Guy is trying to address his microphone. We've heard Governor Carney talking about addressing the the racial disparities as far as COVID-19. What does that mean to you? Like what should we look for coming from Governor Carney as far as addressing those issues?
I would Oh, I heard an echo. I apologize. I can't speak specifically to the governor's agenda. My personal view is that without a cure, which we don't have, and as of yet, no vaccination, that the efforts to reduce racial disparities have to be focused on reducing the spread. Racial and ethnic minority groups are disproportionately more likely to have to engage in essential work, as we described previously in this meeting. So assuring protections for those people who are compelled to have to work despite the increased risk would certainly be something I would personally advocate for. Again, I am speaking personally as Roy Hex. The second thing that I think is important to address are those situations in which there may be overcrowding, which we know, again, definitively a risk for COVID-19 transmission, where minority groups may disproportionately participate. So for instance, within the public schools, where the student per classroom sort of number may be upwards of 30, for instance, what does the spacing look like indoors, where we know the disease is more likely to transmit in a room of 30 kids if the kids can't remain more than 6 feet apart. And obviously, racial and ethnic communities are much more likely to utilize those school settings. And even though kids are at lower likelihood of mortality, again, it doesn't mean that they won't pass it to their 70-year-old grandmother, right, within their household. So I would focus largely on the social constructs, income, overcrowded conditions. I would also say availability of hygiene. In many instances early in the course of the disease, it was very difficult for people to have access to EPA certified cleaning solutions. They were underpopulated on the shelves of many stores that are in urban communities. Alcohol-based hand washing solutions were hard to find. So as those resources become available, I think making sure that communities at risk have equal access to them is, again, we're focused on disease prevention largely. Those would be some of, and establishing a system for both syndromic surveillance, as I mentioned before, and for contact tracing when patients, when people are tested positive, I think critically important to addressing disparities. Again, the goal is to preempt more rapid transmission and rapidly identify when groups are at risk. And the last is, again, mandating or addressing differences in availability of health resources. There are communities where broadband access, I would imagine, is more of an issue than it is in others. I have seen data across the state that suggests that there are relative broadband deserts in communities that seem to be disproportionately minority. So addressing the differences in broadband access, again, critical because that's a primary means by which care is delivered during the pandemic. And doing that, addressing that, I think will be also key to addressing health disparities.
Okay, all right, thank you, Dr. Hicks. Does anyone from the public have any questions for Dr. Hicks? I mean, there are a few people here. And if no one else from council has any questions, Councilman Guy, are you I still can't hear him. Okay, Dr. Hicks, I really appreciate you giving us this wealth of information. In case anyone from the public wants to contact the hospital or your office, how can they reach your office if they have any questions or concerns?
I will make it available, and I apologize, I did not bring it with me. We have a very active Office of Community Engagement and Health Equity at Christiana Care, and in our forums with the community, we actually prepared an online link for people as well as a central phone number.
Okay.
Call. It's pretty rapid access, and I apologize for not having it at the tip of my tongue. If okay with you, I will make sure that it's in your hands by tomorrow.
Okay, I really appreciate that. And And then the constituents can call city council office and they can give them that information. All right, well, again, thank you, Dr. Hicks, and keep giving us, we'll definitely have you back.
It will be my pleasure.
To give us an update on how we can, work together.
All right, it will be my pleasure. Thank you for the invitation.
All right, thank you. Councilman Guy, are you able to? WITN, do you have any suggestions for Councilman Guy?
Yes, we suggested that he log out and then log back in, but he hasn't done so.
Councilman Guy, if you're able to hear us, can you log out and then try to log back into the meeting? Okay, I think he's doing that now. So we'll give Councilman Guy a few minutes to log back in and see if his audio will work. Councilwoman Harley, did you have a question?
Yes, while Councilman Guy is preparing to connect, I just wanted to say, is Dr. Hicks still on the line?
I don't think so.
Oh, okay.
No, he's not.
Well, thank you, Councilwoman Dixon and Mr. Chair for having Dr. Hicks. I think the information that he shared was definitely very valuable. And I think it was a great discussion. So thank you.
Someone typed to Sam that he should push the blue button that says join the meeting. Audio with computer.
I think he's coming in now.
He's back on now. Councilman Guy, I think your mic might be muted. The resolution that's on the agenda next, that's Councilman Guy's, right?
No, that's mine.
Oh, that's yours. Okay, I'm sorry. Sorry, Councilwoman. Well, we'll go to the next item on the agenda. Hopefully, Councilman Guy can get his audio situated. So next, we have a resolution in defense of Black lives and a commitment to enacting policy that defend Black life and aim to undo the effects of systemic racism affecting Black people in the city of Wilmington. And Councilwoman Dixon, you're here to speak to that?
Yes. Thank you, Chairman, and wanted to thank you all for starting the conversation last, and thank you, Councilman Congo, for agreeing to allow me to put on the agenda for this evening. What we had, and I will preference is that I put this prior to the around the same time that the Racism for Public Health came out, and I didn't know what was in it and not. So some of the language I did see does overlap in some cases, but only in the beginning when we talk about when Africans were first brought in into America and kind of talking about the slavery kind of component of it. But what I wanted to do to kind of make it more specific to the city of Wilmington and kind of go through the city of Wilmington's history of racially motivated violence against Black people, and then also to seek to conceptualize that the city's own racially motivated acts of violence against the police, as well as against its own Black citizens, and that the resolution solidifies and pledges that the city council would keep evolving around the history of the pain and healing at the forefront as a legislative body, and that we seek to look for solutions to preserve life in the city of Wilmington, as well as acknowledge input from citizens and groups who agree that Black life in the city of Wilmington should be acknowledged as an extension of the city's history, as well as motivation for a better community for everyone who lives, works, and plays here going forward. And what I had staff do also as they were putting it together, focus more on what those different acts have been over the course, which includes also the latest that happened on March 30th with the protests to be included in that as well, since there was so much being talked about in areas of where they wanted them to cancel it. That's also an important piece of our history in the city of Wilmington that we need to capture, in addition to all the other marches and rallies that are happening in the city. So as we started last week and having a conversation, I am happy to add some actual solutions to the resolution or make it into an ordinance, whatever we need to do in order to add some more teeth, as we talked about last week, into the legislation. So I wanted to hear from my colleagues, as well as I know the public at one point felt like they were shut out from the conversation regarding racism in the city of Wilmington. So I wanted to give you all, my colleagues, as well as the public, an opportunity to really have a conversation about it.
Okay, thank you, Councilwoman Dixon. Councilwoman Gray.
Thank you. I think this is, I was the person who said resolutions weren't very meaningful, but I think that this is a great education piece for those, including me, who were not here in '68. I happened to be in DC with the riots. So for that reason, I think it's excellent, and I would have no problems with it being an ordinance. It also will continually remind people of the strife of Wilmington and nationwide. And after other people talk, I have some other things to say, because I've been very disappointed and upset that council members have not been able to discuss what's been happening in Wilmington and the police brutality and different things that we would like to change and like to discuss. We have not had the ability to do that thus far. So I'm really complimenting Councilman Congo and the fact that Councilman Dixon brought it up at our last council meeting, that you would welcome comments and discussion. So I'm happy about that. And I'll have comments later, but thank you. Is there anyone out there?
Yes, I do have a something I want. Somehow I think that we have to. I know we tried to address the lack of diversity in public safety, with the fire department and the police department. I'm not sure if that's something that we can legislate or not. If we could have quotas. I'm not even sure which direction we need to take with that. But we definitely need to address the severe lack of diversity on our police departments and our, even worse, our fire department. I mean, it was met when council held up the resolution to approve a new class. It was met with so much pushback. It was unbelievable, and all we were trying to do was try to make the police department more diverse. And it was just met with pushback from some council members, from the administration, and the chief of police. And that was pretty disappointing. So we really need to stay on top of that topic, and we have to do the same thing with the fire department.
Councilman Congo, I agree. Councilman Turner, I agree with that.
I think the chair's having a problem with his mic.
Councilwoman, Gray, you have a question?
No, I didn't have a question. I was just going to say that I was in the public safety meeting, and we were several of us were totally shut down in discussing any changes to the policing in the Wilmington area. And also we didn't have any opportunity to discuss what had actually happened here beyond Saturday. That was the only discussion. So in the meantime, I have a whole list of things that I think that we could possibly do. I don't think we can get them accomplished because, like I said, at the public safety meeting, we couldn't even discuss possible legislation that we would want to go forward. And now I think it's too late before this session ends. But still, these are things that people can think about. We can get federal grants for de-escalation, for training for the police. We can make police disciplinary action available within a very short time period, like within a week of when they're disciplined. We can make, it turns out that the Police Bill of Rights prevents people from knowing what they're charged with or any of the investigative information. And that's something that we could pass a law for, or an ordinance for in Wilmington. No chokeholds, I think that's on our agenda coming up. Also, I don't know if people realize that if you're arrested, you can be held for 24 or 48 hours. I'm kind of vague. I've been out of criminal justice for a while without ever being charged or being told what you're being held for. And police have to be told immediately. They cannot be held.
Testing.
Who's that? I'm sorry. Also, I want to also point out that a lot of the commissions and task force and things like that are they're just putting us off. They're just making us wait. They're not taking any action. And also task force and committees frequently don't have any power. They're just studying. We don't need anyone to study our problems anymore. We need someone to take action on them. So I just want to make everyone aware that all the task force and committees and different organizations that are going to get together and study and talk about the problem, we're way past that. I mean, we know what the problems are. So I'm just making people aware of these things. And the same thing with body cameras. We've been talking about them. And I understand there was a pilot program before I ever got on council, and they still want to study it or discuss it or wait till we get the grant. So this is just my rant that I didn't get out before. Thank you. Oh, one more thing, sorry. I think I have 4 or 5 news releases from the mayor and from the Mayor Puzicki and Council President Shabazz. I just want everyone to know that not one of these did council discuss what President Shabazz put out. Now, she's putting it out by herself. I hope people don't think that the council had some input in it. I'm not saying that I disagree with all of it or any of it, but some of the things they say, like create a police review board, when, how, where. It says it's going to need legislative and contract changes. Well, the police contract is up for council approval. So if that is needed, then we should be discussing that. So I'm just totally frustrated that we need to discuss these things and they're being put out under our name. Thank you.
Councilwoman Dixon.
No, I was just actually just gonna
No, I wanted to add to that too. Council has to be involved with our schools, our public education. I know right now we don't have any real authority. Schools deal with our children, how they what they're taught, how they're disciplined. But I know there's an awesome community advocate and he was telling me that
I can't hear you. You're going in and out. Please repeat.
Okay, can you hear me?
No.
No.
Now, yes, now.
Okay, I'm not sure which part you weren't able to hear, but somehow on council we have to try to become part of the solution when it comes to our public school systems. And and how they teach our children, what they teach our children, how they discipline our children. We have an awesome community advocate named Devin Henson, and he was just sharing some of the tragedies, atrocities that happen. Just when a child who is in school is accused of a crime, not even found guilty, that hasn't even gone to court, but is just simply accused, what happens and how they can be suspended from school or expelled from school without a trial, just on accusation. So somehow we have to address those issues also.
Okay, agreed, Councilman Congo. You're definitely, and I know Red Clay School District started having some of that discussion regarding taking out the officers out of the schools. I know they had started, I think they're going to vote on that next month. But yeah, there definitely needs to be, because as you said, Devin has been working on the front line for years, working as an education advocate, and has told me also about a lot of the that he's had during the public schools. So definitely public schools, charter schools, all need us to really look at how we advocate for our kids differently, for sure.
Councilman Guy, you have a question?
Yes, can you hear me?
Yes.
Oh, finally.
Okay. Well, it was good because I did get to hear the presentation and I just heard the discussion. And I guess kind of for me, it's really sad because I was on a council where all of these issues that you guys raised that needed to be discussed and didn't get to discuss for 3.5 years. That was the purpose of a judiciary committee. Almost everything you say, that's where we dealt with all of those issues 20 years ago. That was the committee through which I created the original educational advocate program and brought on B. Carroll to represent any child facing discipline in the school district. She was paid by the city to represent our children. And a pardon program in places where issues could be put on the agenda, like civilian review board legislation, like the one that I've submitted this time. All these issues about body cameras, these are all civil rights related issues where basically, you know, we talk about systemic racism, and a lot of these resolutions are getting to that. In fact, I think Councilwoman Dixon's resolution specifically mentions that term, if I'm not incorrect. And if you don't know, if you really don't know in a government situation, the systems of racism, then you can't fix them. And the people who have been dominating this city council through the systems of racism. Wilmington City Council has been dominated through systemic racism. When we met to vote on body cameras, which is coming up, but I'm talking about the systemic racism part. No Black person chaired a committee to have any say. The 3 Black men that been on this body longer than any of the other Black men on it had no vote whatsoever. So there's always the talk about looking out for our children. As 3 Black men, we wasn't afforded a right to vote on whether city council would vote on things. So this resolution about systemic racism, for me, it's right on point with us making a statement. But then after we make the statement as a group, we've also volunteered in some regards to be victims of systemic racism, because the people who implement this on our community, they always know, well, we can get 6 people or do what the community needs, and they can figure out a way to get what they need to keep that from happening. So the real question in government is, how do oppressed people historically that own 10 out of 13 seats stop allowing folks to oppress you? So your resolution, I'm all the way for it, but through our behaviors the rest of the way, we need to start acting like it, because they sitting back laughing. If they had known, if the folks who implement systemic racism, if they knew what they know now, they'd allowed there to be 10 out of 13 Black council people 50 years ago. Because it's actually easier for them to mess our community over when it's people of color doing it. So I'm all for this resolution. I don't believe it can be an ordinance. This is a statement. This is not, to me, I'm into ordinances or resolutions that do something, but sometimes you need to say something, because if you vote and say something, now you got to make your behaviors match up with how you vote. So I'm for it.
Councilwoman Gray, and then Councilman Adams.
Can I have my hand up again? It was probably a mistake, but I
Okay.
just want to say I'm definitely supporting this if I didn't make that clear. But that's it. Thank you.
Okay, thank you. Councilman Adams?
Yes,
And
Councilman Congo, you know, I get my integrity impugned by Mr. Guy at every meeting, and so it's about time I say something. Now, I have no white guilt, which is different from what Mr. Guy is implying here. My mother's parents immigrated from Italy, and my last name is Adams, who have been abolitionists for over 500 years. Now, what I'm saying to you is I don't implement any white supremacy on thing, and the only racist I'm sure of on city council is Mr. Guy. Now, his insistence to constantly be a racist leads him to not collaborate with anyone on council. And that's why he's always on the downside of every vote, because he can't get along with people because of his racist attitude. Now, would you please stop impugning me, because I have no guilt, and there's never been anything in my history or my family's history that would ever lead you to believe that I've ever intentionally caused anyone any problem via racism. Now, I admit racism is an issue, but it certainly is not the only issue in the Black community. Yes, George Floyd's death was a horrifying, absolutely. I wrote that. But you know what? Minneapolis had over 100 shootings since George Floyd passed away. And so and what I'm saying to you is that his murder doesn't correlate to anything that Mr. Guy constantly states. You want to improve the Black community, improve education. You want to improve the Black community, do something about a minimum wage. You want to improve the Black community, there's many things to go down a list of. But I'm tired of sitting here doing my best to accomplish something for this city of Wilmington and being impugned by a racist constantly. So, gee, Councilman Trippy Congo, would you please limit the discussion so where that he's not assaulting the other individuals who are part of council, who's trying to be productive and add to your committee. And I certainly would appreciate that. Thank you.
Yeah, maybe I was going, maybe I didn't hear, but I did not hear Councilman Guy direct anything towards you, but I will let him, he does have his hands up. I will let him.
Yes, I think that Shakespeare, they say thou doth protest too much. It's accurate. I never said, I said your two other people's names who practice white supremacy. I called them by name. I didn't say anything about you, but you just volunteered your hand up in a sense, saying that what I said applies to you too. You just did that. But more importantly, I encourage all council members, as we talk about wanting to get rid of the systems of white supremacy, what just took place is a perfect example. His concluding remark was to try to say that I shouldn't get to speak, because normally the systems of white supremacy shut down Black voices when folks don't want to hear the voice. So this is a perfect lesson in how the system works. Now, it just so happens that there happens to not be a person who operates pursuant to the systematic rules of white supremacy. And so I'm having an opportunity to speak on Councilwoman Dixon's resolution. So I'm not going to let the comments from the side interfere with my statement to you, Councilman Dixon, that I like this resolution, and it is critical for all of us, Black and white, to identify and understand how systemic racism works. Somebody could write a book on Wilmington City Council if they took 4 years of city council and said, how did systemic racism and selling out operate to harm Wilmington's minority community? So I'm the author of over 120 some pieces of legislation, by the way. So whatever you're talking about, when you say what I don't need to do, you might need to check my legislative record. And only but for white supremacy voting against some stuff because they don't want to see improvements, there'd be a few more things that would pass. Okay, but I didn't design this system of white supremacy, but I'm an expert in navigating it. So when you get to 120, call me. That's all I have.
Councilwoman Gray, I see your hand is up. Do you have did you want to speak, Councilwoman Gray? Councilman Adams?
Yes, I'd like, as I said, I'd like to be able to focus on what we're trying to accomplish here. And Council Lady Gray and myself are the only two people who've had the opportunity to vote for body cams so far. We both voted for them. So again, every time you say that council acts in a white supremacy method, you are impugning my integrity as a member of council. And so if you're looking to accomplish something as far as implementing body cameras, Council Lady and myself, Gray and myself have been on the same side on this issue. So if you want to direct your claim specifically, however, the generalize makes you the racist you are, Councilman Guy, and I'm sort of tired of being impugned on a daily basis every time I join a meeting. Now, if Ms. Dixon wants to pass this resolution, then hey, so be it. She can put forward what she wants to put forward. However, don't sit there and call people on council white supremacists, because I'm not a white supremacist. And for you to say, well, he denies it, so that makes him a racist, that is utterly ridiculous. And to be quite frank with you, it's a long time since we've been past these issues, and then we start making changes to them. Now, Mr. Congo, if he wants to, again, impugn the council of which I'm a member of, then he's impugning me also. And that's, there's no difference then. Let him be specific and call that. And 120 pieces of legislation, he may have had, what, 3 passed? Okay, only because he can't collaborate with other individuals because of his racist attitude. And so, hey, can we please get back to Ms. Dixon?
Okay, Chairman, can we get out of the sandbox with these two? We're tired of playing in the sandbox. In fact, I am. So can we move on? You two can contact each other and argue. I know both arguments. I'm not taking sides, but I just think we should move on.
Yes, we do have a.
And that's what I've been asking for, Councilwoman.
Okay.
Let's move on.
Okay, Cyril.
Can you hear me? We do have
Yes,
a question. We do have a question from someone in the public, Johnson. Why
Yes,
Johnson?
I just wanted to concur if we could move on past the name calling and them two can hash that out at a different time, if we can move on with the agenda.
All right, thank you for joining us, and thank you for your comment.
Thank you.
Councilwoman Dixon. Did you have any follow-up with your resolution?
No, other than that, I think I appreciate the comments and the feedback on the legislation, and glad to hear that you all are in agreement with it, and would love to have my colleague join me as co-sponsor. If you're willing to do that, we'd love to have you join, and like Councilman said, and more of making a statement, and then utilizing the next pieces of legislation like body cameras and others to be the vehicle as solutions to the issues. So again, thank my colleagues for the discussion and conversation. And I just wanted to make sure that we had space and room to have the conversation today.
All right, we do have a couple questions from council members. Councilwoman Harley and then Councilman Gray.
Thank you, Mr. Chair. I don't have any more to share on the topic. I just want to say that I think it's a good piece of legislation, Councilwoman Dixon, and I would like to be added as a co-sponsor. Thank you.
Councilwoman Gray, is your hand up?
Yes, I would like to be added as a co-sponsor. Thank you.
Okay, this does not need to be voted out. This is a resolution. Will this be heard on our next council meeting? At our next council meeting, Councilwoman Dixon?
It is supposed to, but I don't think I have a date on mine.
It's scheduled for July the 2nd.
Thank you.
Okay, so this will be heard at our next council meeting on next Thursday, July the 2nd. Thank you, Councilwoman Dixon. Okay, our last item on the agenda is a discussion on body cameras. Councilman Turner. Did you want to speak to this?
Thank you, Councilman Congo. Can you hear me?
Yes, we can.
All right, it's been some trouble with the Zoom on this meeting. Yeah, I just wanted to bring this up to discussion. We've been fighting body cameras as a council as a whole for about 2.5, 3 years since we kind of came into city council. It's been on the radar, and now we had an opportunity to bring the ordinances out of committee, which some of the committee members weren't there. They were absent, which I could understand. You know, sometimes we have some other business to do, but that was November 19th. November of 2019. We are now in June of 2020 and getting ready to go into July. And in light of things that have happened across the country and inside of our direct city, we've now had statements from our mayor stating that there is money in the budget. So I don't know what's the holdup if the mayor said there's money in the budget of why we're not putting this resolution forward in a committee, and the ones that were absent or may have voted no can now vote yes or attend, and we can move this forward for our residents of the city. Now I know that it may be some arguments that comes up and starts talking about other things that we need as far as the police department, which I think that all of us are in agreement. All of those things happen. I don't want this to be a situation where someone's screaming out Black Lives Matter and then someone's going to scream out all lives matter. We do know that all lives matter. We do know that all protection to protect our community matters as well. But on this specific item, we're talking about body cameras. So now body cameras matter. That's all I have, Councilman Congo.
All right, thank you, Councilman. Councilwoman Gray, did you have your hand up?
Yes, I do have my hand up. I totally agree with that, and I understand that the council was attempting to get body cameras even prior to when I came on, like 4 or 5 years ago. And I have the news release dated June 5th from Mayor Purzycki and Councilwoman President Shabazz. And it says pledge to support racial justice reforms. But one of that was commit to the use of body cameras by the Wilmington Police Department without delay. The mayor will immediately make available $800,000 in city funds that would otherwise be required to match the $800,000 federal grant for which the city has applied. If the grant is denied, the mayor and council will identify additional funds to implement the body camera program. Well, this is the same thing they were telling us all along. This isn't any different than what council has to come to, or we haven't been able to vote past this. They're just saying once the grant comes in, they will put forth the additional money, which was always my understanding, to bring body cams. But the police chief made another statement, which I don't have here, which I think gave a more precise reality to what they promised us, is that the grant, we would find out if we were approved for the grant in, I think, August or September. And by time they acquired the cameras and trained the police officers, that they wouldn't be on the street until January or February of 2021. If I'm inaccurate, please someone correct me. And from this statement, I think that's what they're saying. It's not any different. And I think the public may have a different idea. They may think that because they said without delay, that they're going to get the cameras immediately. Based on the model that they gave us in council and in committee meetings, this is the same model, and the cameras won't be on the street before February. And that's if we get the grant. So, and my only other comment is, Councilman Turner, I would hope that you'd make that an ordinance rather than a resolution that our police.
It is, Councilwoman Gray, there are 2 ordinances.
Oh, okay, thank you. You said resolution, so I didn't know.
I misspoke, sorry about that.
Okay, well, that's great. So I'm just telling the public or other council members that what the mayor promised is the same thing we've been being told for the past several months. So I think we need an ordinance to push this through and make it happen quicker. And with the information that we're continually given, and even at the last council meeting, it was stated that we don't have the money to spend on this because of COVID and not knowing, and the fact that we won't be getting as much tax money. Tomorrow at noon, there's going to be a bond meeting. The city's going to have a bond meeting. It is a public meeting. If you can get the Zoom address. And I think that we have enough money in the bank to do a lot of things. My understanding just recently is that there are tons of projects that they went to the bond market and got money for, and they haven't done the project yet. So we have money in the bank that for other projects that haven't been done dating back to 2016. So some of that money could be used to acquire body cams. And, you know, if we need to know which projects have been put on hold since 2016, so obviously it wasn't a rush, we possibly can acquire that information from the mayor's office, and maybe they can take the money from those projects. Thank you.
Councilman Guy.
Yes, you know, in government, they always talk about the 3 parts of government: the executive, legislative, and judicial branch. And then you have your educational system at the state level. In Wilmington, we have an executive branch and a legislative branch. And if you've never been on the executive side, there's a lot that you don't get to see as to the games that are available to the executive side to just play games with the people on the legislative side. And that is what has been happening to us on the issue of body cameras. Now, I'm going to tell you how simple this is, because I was chief of staff for County Executive Gordon, Newcastle County. So that means I've been on the executive side. That means
point of order,
I
Mr.
can,
Chairman. What is this
I know
equality
exactly
about?
what to do to implement. Did somebody say point of order?
Yes, I said point of order. What
Okay,
is this
that's the
soliloquy
example
about?
of
Okay, aren't we
systemic
trying to focus
racism.
on something?
No, you're not interrupting me. I'm finishing what I'm saying.
Councilman Adams,
That's how
please let Councilman
systemic
Guy
racism works.
finish his statement.
Now I'm telling you all
Sure, if I
about
could
how
get
you
3 minutes
implement
to
body
recite
cam.
an entire thing.
You see how he's trying to
Councilman
interrupt?
Adams.
That's systemic
Councilman
racism.
Councilman Adams, please let Councilman Guy finish
That's
his
correct.
statement. We're on
Sure, but
discussion.
why does he need a
So
soapbox
it's
if it doesn't
so
focus on
when
what
you're
we're
on
trying
the
to accomplish?
executive side, you
We're on.
implement projects, but you can't implement them until the legislative side has given you the proper authorizations. But even when you're given the proper authorizations, the executive side can do all kinds of things to delay. So now getting back to what I need you to understand is I've been on the executive side as a chief of staff with County Executive Tom Gordon, who was born and raised in Wilmington. And guess what we did? We implemented body cameras effective 2016. So I know exactly what needs to be done on the executive side, and I know every game that they're playing not to do it. Now, it's really this simple. Once the county exec Gordon, who's the equivalent of a mayor, says to his chief, implement the body cameras and makes the money available to buy the cameras and tells them to make staff available, it's over with. So the truth of the matter is we got to pay attention. When this started before all of the chaos in America started. Councilman Congo and Councilman Turner introduced their legislation for body cams before that. So we're not reacting to what's happening in the world. They were proactive with that issue. I fully support what they were doing and made that clear. So where are we right now? Where we are right now is they introduced an ordinance based on the current year's budget. They did a budget amendment for the current year's budget. They also put in an authorization to enter into a contract. Those are two pieces of legislation. Those two pieces of legislation got sent to a joint meeting of public safety and finance. Now, when I talk about systemic racism, those are the key committees that the president would always send stuff to that she wanted to lock up in support of systematic racism. We've lived through that. So now what is our move? What is our move to get the vote if we need to vote? So the first thing is we can sit here all day long and wait for Bud Friel and Loretta Walsh to schedule another meeting because they've had plenty of time to schedule another meeting so that these two issues could get out of committee or they could hold them again. But if they don't even call a meeting, they don't have to worry about them ever coming out of committee. So basically those two individuals, because they get to call the committee meetings for their committee, are able to hold up a 60% African-American community with 10 out of 13 Black elected members of council from being able to even vote and have a discussion about implementing body cameras. That's how systemic racism works. So now what do we do? Well, the first thing I think that we do is we take note of the fact that this budget year is almost over. So that ordinance to amend the budget, that'll never see the light of day because the budget year is almost over. So they was effective in shutting that down by just holding the ball in the four corners. Just held on to the ball. So now that legislation has to be updated for this new year, but it doesn't really have to be updated Because I need y'all to understand from the executive side, all of their budget lines have just been replenished. So soon as July 1st gets here, there's enough money in their budget because everything is maxed out to go ahead and buy the doggone cameras. All we got to do is pass that piece of legislation authorizing the purchase of the cameras. That's why the game that they played at the last meeting was they voted to not do the budget amendment. And then they just took the legislation for the contract and just stuck it in their pocket and didn't even vote. That was the one that mattered. Because if right now the mayor had authorization to purchase the product, then this whole problem would be on the mayor's desk. Because on July 1st, all he would have to do is tell the police department, here's the item that authorizes us to make the purchase. And all he's got to do is tell the chief to go over there and make the purchase out of his budget. And that if he needs an extra 800,000, the mayor can send him over 8,000 out of his budget. But the chief of police has enough in his budget line because everything is maxed out on July 1st. So these are the games that's being played. And then all he has to do is tell the chief, reassign 4 people to operate the program. See, I've been involved in this taking place. So it's too simple if you want to do it. But if you don't want to do it, then you tell lies to people who don't know and say, oh, we need to have a whole new class to get a staff to fill these positions. No, you reassign people. We're not talking about all that stuff that's going on all over the country or cut the size of the police department. We're saying take 4 people, reassign them. You got a class coming, so you can then take that new class and have them backfill those 4 or 5 positions. So they have the people to do it. July 1st, they have the money. So we need to authorize him to make the purchase. And just a side note, sending out a press release to the media is grandstanding for Wilmington's public to say, I'm the mayor, I'm trying to get body cameras, when we know doggone well 6 months ago, the chief of police was at a committee meeting and told us he already got the regulations drafted up, never sent us a copy of them, but he says he's got them drafted. That's what he told us. It's on the tape. Go listen to it. He also told us, the HR told us, oh, well, we got to negotiate that with the police. Well, I'm telling you that depending upon what your rules and regulations say, you may have to negotiate, you may not. But if you all remember, a few weeks ago, there was a piece of legislation on the agenda for us to vote on the police contract. You notice that it vanished, and you notice nobody ever said to us whether or not there was an agreement that had been reached about body cam. But you don't have to have provisions that require negotiation. If you want to have those kind of provisions, you can. So I'm just telling you that it's this simple. We need to get the approval for the purchase done ASAP. And I think I might have introduced a twin to my colleagues' legislation and told them that I'm putting this in. And of course, the people who control the system to implement systemic racism don't have it on the draft agenda. If you notice on the draft agenda, it's not on there. Because all we need to do is introduce it and refer it to this committee, since they've already said that racism is a health problem. And in the resolution we voted on the other day, they identified body cameras as a solution. So this committee is as legit as when Bud Friel had a blight ordinance and sent it to the land use committee, and it got held. So he reintroduced it and referred it to the finance committee. That's all we have to do is reintroduce it and send it to a committee where white supremacy isn't just saying to us, I'm not even putting it on the agenda. So it's too easy. All we got to do is do our part. And now the mayor's sitting there, and all we got to then say to the public is he's authorized to buy them. He has the money, and body cameras should only take 60 days, according to what the chief said. There's a tape where he said, well, if I have all I need, that's all I have to do. That's all it's going to take, because he already has the draft regulation. So this is too simple. And this is why the way white supremacy works is when there's knowledgeable Black man in the room who then ran a government, they always want to say, shut up, we don't want to hear what you're saying, because they don't want you all to know what I know. It's that easy. If anybody has a question, ask me whatever you want to ask me, and I'll tell you. That's all I have, Mr. Chairman. Thank you.
All right, thank you, Councilman Guy. Really, I know I do, and I know several people in the public and on council really appreciate the knowledge that you bring and the history that you bring, especially when it comes to body cameras and how we can implement them on council. You mentioned it. I'm not going to go back and rehash everything you said, but there have definitely been games played from the administration, from the police department, and in cooperation with some people on council. But I do think that we have to move forward, and we have to hold our staff accountable, council staff accountable. We have to hold our council president accountable to putting things, items on the agenda that we're requesting. I'm going to go to Councilwoman Gray. She has a question or a statement.
Yes, I'd like to thank Councilman Sam also for clearly laying out how the games are played and what our possibilities are. I've been studying the county, and I looked into the county and how they acquired their body cams. And I had discussed that at various committee meetings, but the city seemed to be very resistant to partner with the county. And I do know that I even resisted approving the police department's budget because they had extra positions in there that I didn't think were necessary in order to purchase the body cams. They needed a couple of supervisors, and I had found out from the county, as Councilman Guy said, that they reassigned people and maybe hired one person. So I really think we need to follow Councilman Guy's suggestion. And I wanted to reiterate that I specifically went to the public safety meeting last, I think it was a week or two ago. And as I pointed out before, Councilwoman Walsh would not let me nor anyone discuss anything related to Black lives, police violence, except what occurred on Saturday night of the riots. So I requested a public safety meeting so that we could discuss things like we're doing here, but we could resolve on resolution or legislation that we wanted to go forth as a whole, as a group. And I was shut down. So I asked for another meeting, and she agreed to have a public safety meeting July 6th at 5 p.m. Now I looked on the schedule for July, and it's not on the schedule. And I understand it has to be it has to have 7 days, and 7 days ends on Monday. So I think I sent an email to everyone. I don't know if you want to come to a meeting on July 6th. It won't give us any opportunity to get any legislation in before we recess. But, you know, if you feel like you want to join, or if we get it on the calendar, it's not there yet. So I'm just making people aware that I did request another public safety meeting so we could possibly get some legislation out. Thank you.
Councilwoman Gray, just as a follow-up. For your request for that July 6th meeting, as part of your request to talk about body cameras or other legislation, public safety legislation?
I had one that I wanted to talk about, one of the news releases where they said they were going to do body cameras. I've already discussed that here. But the other second thing on the agenda, I wanted us to have the ability to discuss anything that related to any of the demonstrations and police violence in the United States. I just wanted it open so we could have an open discussion. And if you have anything, she hasn't put it on the calendar yet, or staff hasn't put it on the calendar, but if you'd like to specifically put an agenda item of body cameras on there, I have no problem.
No, I just based on the history of the conversation around body cameras, I know your intents are good. Your intentions are good, but I just don't know if they're gonna just hold it and not allow us to have the conversation. Fortunately, we do have other committee meetings where we can have the conversation. Again, I just want to thank Councilman Guy for his brilliance and him recognizing that we can have that conversation here. And I think we just have to hold our staff accountable and our president accountable to putting things on the agenda that council members want. I don't know if Councilwoman Walsh will allow that to be on the agenda, unfortunately. But if we follow Councilman Guy's suggestions, I think that we will be able to move forward. But I'm not trying to say shut your meeting down. I'm all for supporting open dialogue and conversation. I just don't want us to go down that road where we've already been shut down. Councilman Turner.
Thank you, Councilman Congo. Councilman Congo, is Chief of Staff Marshall Bastnight, is she on her Zoom or meeting?
Yes, I'm present.
Yes.
Thank you, Chief of Staff. Chief of Staff, is it possible that you not possible? Can you put on a July 6th calendar to reintroduce ordinance 19-045, which is to authorize and approve a contract between the City of Wilmington and Axon Enterprise Incorporation for body cameras and related services?
Councilman Turner, that's a request that have to go to the to committee chair. The chairperson sets their agenda.
No. I'm not asking for a committee. I'm asking for it to be reintroduced for first and second on the floor on July 6th City Council meeting. So I don't have to ask the chair because I'm not asking for it to be back introduced in the joint committee. I'm asking for it to be reintroduced as a first and second on the floor of the July 6th meeting.
Now, July 6th is a public safety committee meeting.
Well, for the next, you know the dates. So the date of the next City Council meeting is what, Chief of Staff?
July 2nd.
Okay, so for the July 2nd City Council meeting, I would like for the 1945 ordinance 19-045 authorize and approve a contract between City of Wilmington and Axon Enterprise Incorporated for body cameras and related services for first and second on July 2nd.
And your staff does not set the council agenda. That request will be submitted to the president.
You said the staff doesn't do what?
Staff does not set the council agenda. The request will be submitted to the president.
Okay, so the approval or the denial comes from President Shabazz. Is that what you're saying?
Council staff does not determine what goes on the council agenda. That's the president of council.
So my request I just requested for, you can't authorize it. It has to get authorized or denied by City Council President Hanifa Shabazz. Is that correct?
I cannot authorize anything on the council agenda that's made by the president.
Thank you. So Chief of Staff, you made note that I requested that it be on the July 2nd as a first and second reading for the July 2nd calendar?
Yes.
Thank you.
Does anyone from the public have any comments or questions regarding body cameras? Does anyone else on council have any comment or question regarding body cameras?
Mr. Chair, does everybody from the public know how to probably unmute yourself or raise their hand? If there's anybody that might be on the phone or not on the Zoom call?
Yeah, there should be an icon or a tab that you can hit if you do want to raise your hand, so you can be recognized, and we can continue the conversation. While they're doing that, Councilman First, before we go to you, Councilman Guy, someone from the public does want to speak. Drew, if you can unmic, if you can, there you go. Now you're unmuted. Thank you for joining us.
Yes, thank you. My brother Ladea and I from Cool Shoes Inc. We're unveiling a new platform where this probably ain't got nothing to do with the body cam, but we're unveiling a new platform where we like to invite some of the city council members to our platform to answer some questions from our level. Because a lot of the stuff that you guys are saying might go over the heads of some of the people in our communities that we're able to reach. So we just like to know, we extend the invite, is there anybody on this call that may be willing to come and sit down with us?
Yes, I definitely will be able. I would love to be a part of that conversation.
Excuse me, I missed who they are.
My name is Jerron Johnson, commonly known as Droop. I run the Silk League, and my brother Ladea Johnson is of Cool Shoes Inc. And we're unveiling a new platform separate from our podcast that we do, where we just want to sit down and engage with our community service and our councilmen, just to get people down on our ground level who may not understand some of the wording, what's going on, to break it down to terms they can understand and be more informed.
Do you have a date yet for that forum?
Yes, we plan on rolling out next Friday, but we can extend it and push back if need be, based on our guests' comfortability.
What time and where?
We usually shoot on Friday evenings around at 6 o'clock at our studio, but we're willing to meet to bring our equipment to a neutral location for comfortability.
Okay, yes, I would definitely like to be a part of that conversation. I'm gonna give you.
Councilman Congo, keep me in the loop. Text me the information once you get all the information, please.
Okay, Drew, can you write down my number?
Yes.
It's 218 8630.
8630. Got you, sir.
Any other council members who would like that information, once they send it to me, I can forward it.
Yeah, this Councilman Guy, they can go ahead, they know they can put my name on. I might just be standing there on Friday anyway.
No, that's the 4th of July weekend.
It don't matter.
Councilman Guy, did you have another?
Yeah, sure.
I see your hand. Was your hand up?
Yes.
Okay.
Okay. I want to come back to what Councilman Turner just said. I don't have my computer open in front of me to definitively share with him all of what I submitted, but I made basically twins of the legislation that they was holding up. And I just want to point out, again, this is how the system operates. Councilman Turner just made a legislative request. Generally, if they don't want his legislative request to go through, the first thing they'll do is they'll just say, well, we got a calendar and it can't be put on the calendar for 30 days or more, just on GP. So even if I give them stuff fully drafted sometime, and they just hold it for 30 days just to hold it up. So Councilman Turner, your request is for them to make a duplicate of what already exists, which means Maribel can take out her Word document, give it a new number, a new agenda number, put new dates on it, and there's no reason why that can't be on the calendar for July 2nd. I've already submitted them the same legislation and they don't have it on the list for July 2nd, what I gave them. And it's the exact same thing that you're talking about. And as I told you in tribute, I know that I needed to get that game started because of their 30-day delay, purposeful delay, and willing to turn the legislation over to you guys once it gets started. So I ain't trying to take the legislation, but I knew I needed to get the clock running as I'm designing solutions. So You just made a request. They already have my request that goes back further back in time. And we all need to take note of something ought to be on that agenda on the 2nd. Okay. And if the rest of us sit up here and everything they want to do, they put it on the agenda and it gets passed, then they just look at the Black community and Black elected officials and like, we just use them to vote for what we want. And when they got something they want to discuss, we just won't put it on the agenda, because that's what they've been doing all this time. So they got 2 requests for that information. So we need to all pay attention. And, you know, when I say what I say, I mean what I say. And I got evidence to support it. And so there's no reason why yours, mine, or whatever isn't on that agenda on July 2nd, because they don't have to draft anything. Maribel has the Word document on her computer. It's that simple.
All right, thank you, Councilman Guy. We have 2 hands that are raised. First, we're going to go to the public, back to the public, Teresa Oliver, and then Councilwoman Rashina Dixon. Okay, Ms. Oliver, if you can unmute your mic. I think you can speak now, Ms. Oliver. I think your mic's unmuted. You should be able to hear you. Ms. Oliver, you still there?
Hello.
Okay, we can hear you now. Teresa Oliver. Yes, we can hear you. You're breaking up a little bit now.
Can anybody hear me?
Okay, I can hear you now.
Good evening. Can anybody hear me?
Yes.
Yes, we can hear you.
Okay. Good evening, everybody. My name is Teresa Oliver. And I guess I'm zooming in because I'm very, very concerned about the fact that the body cams were why the majority of the body, you know, voted no. Is it no because it's not in the budget, or is it no because they don't feel that this is not a good, you know, that it's not necessary? What was the reasoning and a rationale behind not, yes, body cams at a day and age when everybody is wanting and wanting this to be a part of the reform? We don't get it. And we're your constituents, and we've been asking years. Is not anti-police. We're just wanting that there's transparency when there is police met with a civilian where it could go left. I think it protects everybody, and everybody is feeling this, and everybody is concerned. And so, you know, I wrote a post, but I'm just concerned as to, I guess we want to know what was the rationale behind or the thinking. Was it because of the budget, or is it because the body doesn't believe that we are there, like we don't need it?
I'll go first, Ms. Oliver. Personally, I think that the budget was used just as an excuse to make the.
I'm having a hard time hearing you.
Can you hear me? Can you hear me, Ms. Oliver?
We can hear you, Trip.
Your microphone goes off a lot.
Ms. Oliver? I think you might have lost her. But I will answer.
Councilman Congo?
Yes. Can you hear me?
Yes, I can hear you.
Yeah, we can hear you.
Okay,
Go ahead and tell her. Go ahead and tell her. She might be able to hear also.
Okay. Ms. Solomon, just from my viewpoint, I think that the budget was just used as an excuse. I don't think there is a sincere interest in purchasing body cameras or even getting a grant for body cameras. I mean, if you look at the history, that kind of shows itself. If we had a study even before this administration, and it fell by the wayside. We brought it back during this administration, and they tried to let it fall by the wayside. And we tried to legislate it. Unfortunately, we couldn't get enough council members to support it. They're trying to act like we don't have the money. They shut us down several times. We tried to get it. We tried to not support the budget because the budget did not have body cameras in it. That didn't work. We gave council members who supported the budget, Councilman Turner gave council members the ability to go back and not support the budget. Those who previously did like a week before, so that we could include body cameras. That hasn't happened. The only reason why they're doing press releases now is because of the national protests and the local protests, and they didn't want buildings to be destroyed, so they brought up body cameras again. Financially, of course, we can't afford it. It all depends on where our priorities are, and it's a shame that the administration and some council members' priorities aren't in sync with the people who they represent. We could definitely make this happen if our council president would put it on the agenda. It could happen sooner than later. We don't have to wait for a grant. $800,000 is not going to make or break us. I believe that the first grant was intentionally not written correctly and thoroughly, so we wouldn't get the grant. I've never heard of us not receiving a grant in my 12 years on council. So it's really frustrating to be a part of a body that's supposed to listen to the voice of the people. We have never heard anyone speak out against body cameras. All we hear is support for body cameras, and for some reason, the administration and some of us on council don't get that. So I said my piece. I'll let other council members respond to it if they so choose.
Councilman Congo, I don't know if everybody has their hand up to address.
So I'm sorry, they do. Councilwoman Dixon and then Councilman Gray.
Yeah, I didn't know if they had their hand up to respond to Ms. Oliver or not. That's why I said that.
Councilwoman Gray or Dixon or Gray, did you want to respond to Ms. Oliver's question?
Yes, I did.
Dixon, okay. Gray, I think you have your hand up.
I was just going to say, I agree with everything that Councilman Congo said, but I was a late arrival to this push for body cams. And when I first arrived, they were discussing the misnomer or misunderstanding that body cameras would reduce crime. And once we got everyone to agree that we understood that, it was just the side that were voting against body cameras kept pushing that they're not going to reduce crime. They're not going to reduce crime. That's not the real point. The point is the public wants them. It can resolve a lot of issues that come up. It's transparency, and it allows people to have a voice about what happened if they can visually see it, as we see what happened with the most recent incidents. When people visually see something, it has a much different impact than if they're just listening to it or reading it or something like that. So once we got past that point, then we went into what Councilman Congo was saying, that there's not enough money. They wanted to do a grant. And I think Councilman Guy has explained that really that was an excuse. Money is not the big problem. And just recently at the last meeting, they screamed that because of COVID, we don't have the money. I'm telling you, pretty much, unless someone proves to me we don't have the money, I think we have the money. I brought up that we have excessive bond money. Councilman Guy has just explained how easy it is, that they're just getting new budgetary money July 1. And then Councilman Congo has discussed that he thinks it also was just a stalling tactic. And I'm just going to give you a little quip that they said. It's kind of trite, but justice delayed is justice denied. And they've been delaying. So, they're denying us our justice. Thank you.
If I can just add to that, Councilman Congo.
Yes.
I was just going to say originally had my hand up for to also say if once Drew has it, that I will also like to be in that discussion as well. But I would say too, to add to what Councilman Congo and Councilwoman Gray just said as well. I remember, if I'm and correct me if I'm wrong, Councilman Congo, but a lot of the conversation in the beginning when we first started talking about body cams a while ago was that we only want to do, there was a number of police that we wanted to have body cameras. And they kept saying that there was, we have to fund all of them and not just a portion, which is what the county has. And couldn't understand the reason why they needed to have everybody have a body cam in order to do it. And that's when they started making it, well, it's a money issue. And then it turned into, well, we are going to apply for the grant in order to do it. From my understanding, from when they applied for the grant, they didn't even ask for federal assistance when they applied for that grant. And the federal, our fellow delegation didn't even know we applied for the grant. So I just wanted to add that into that, as everyone has already stated, we have been in support of getting body cameras, but again, as Councilman Gray said, it's continued to be an added excuse after every single time. And then I'm still trying to understand from the press release too, where that $800,000 that we're going to get once we get this, and where the $800,000 could be now if we had snipped some of the other parts. So I just wanted to add that into the discussion as well.
Okay, thank you. Councilman Turner, then Councilman Guy.
Thank you, Councilman Congo. I just wanted to give Ms. Oliver a history lesson of some of the things, the history of body cameras since we've been in council. We first talked about this in 2018 about the body cameras. When we spoke about it, we were told that we were going to apply for a grant for body cameras. We allowed them to try to apply for the grant. When they came back to us 2 months after the deadline of the grant, they then told us that they missed the deadline of the grant, what took us into last year what took us into this year. And then this year they went on and put the grant in, but the grant doesn't get approved until October, and then we don't get the money until, we don't know it's awarded until August, but don't get the money until October. And then we would make a budget amendment the following year. Where we are, and we were told during this process that we didn't have enough funding, that we only had funding for half of the police department. Now, if you see with the recent press release, the mayor stated that they have $800,000. So before we were told we didn't have anything, then we could get half, but we wanted to go ahead and get this grant. Now we're still playing games where we have the incident that just happened nationally. We have incidents that happen locally, and now the mayor wants to say that he has $800,000 to do it. What we're saying is if that's the case, whoever voted no and whoever was absent from the committees, now we go ahead and put the legislation back through, and the ones that was absent, we don't know why they were absent, but they didn't have an opportunity to vote. Now they should be present, and now we should now vote it out, or we vote the new legislation through and make the proper amendments to the budget. First, like Councilman Guy stated, let's get the contract passed. And once we get the contract passed, no matter what we do as far as the budget, now that will already be in place.
Councilman Guy.
Yes. Ma'am, I want to answer your question. And could you say it one more time so I make sure that I say what I really want to say?
Yes. I feel that we shouldn't even talking about whether it is in a budget or not. It should just be in the budget. We have been asking over and over again, and I'm telling you as a Black mother of Black children, of a Black son. And again, I'm not anti-police. I like police. I don't have a problem with them. I am just saying that for transparency purposes and for the safety of all communities, not just up there where Market Street is, from 2nd Street to 10th Street, where there's nothing but police walking all day long on the beat. We don't have that luxury. They're not walking in our neighborhoods. They're not communicating with us. They're not, we don't have that. So if we're going to, if my melanated skin, right, is synonymous with fear or uncertainty or whatever, then I need them to have a body cam so that I am sure that my son is going to make it home, or that people in the community are feeling like they're safe. That's just it. It shouldn't even be a question as whether it's in a budget. We just now spent millions. We're spending millions. So I find it hard to believe that it can't be in the budget. And so to casually say no without giving your constituents an answer or giving them any reasoning or rationale behind it, I just feel like that's just slapping an insult. It's not okay. And it's a lot of people that's feeling this way.
Okay, so as raw as I can give it to you, it's basically, this is the situation that you have. The beauty of a local government like Wilmington is that it basically takes 2 weeks to introduce a piece of legislation, you have a committee meeting, and 2 weeks later, you can vote on that piece of legislation. That's the norm. So I want you to understand how fast government normally operates at this local level. So the fact that this thing has delayed all this time, and I'm just talking about for the full council to either vote yes or no, let you know that there's people manipulating the process. And the people manipulating the process are the mayor, the chief of police, the chairman of the Public Safety Committee, Bud Friel, and the chairman of the Finance Committee, and the chairman of Public Safety, Loretta Walsh. Each of those people has done everything that they can do to make a simple decision never have an opportunity to be voted on. And I'm telling you, I said it earlier, these are the lessons as we are all out marching and protesting, and it's Black and white and Hispanic saying we got to get rid of white supremacy, we got to get rid of systemic racism. What you're living through that you're saying, I don't understand. That's what systemic racism does to Black people in this city, in this state. It has you wondering, like, well, what's the issue? The issue is the people in the positions have that the power is not distributed amongst everybody, and folks won't even allow basic principles of democracy for a vote to take place. If the vote takes place, it's going to pass or fail. But if you use your positions of authority to say, I'm not even letting them, all those folks on city council, don't let them even vote. Because from a civil rights perspective, my elders, when I was a young buck, it was 2 Black people on city council. So the elders that raised me up, they sitting back looking from heaven saying, how can we have 10 Black elected officials and can't even get the vote on body cameras, and the people want it? So we're suffering from the sickness. That's why what seems crazy to you, that's what's going on. Don't even allow us to exercise our vote. You are duly elected, all 13 of us. That crew is able to exercise the positions that they hold. The president of council gave 2 of them that inordinate power to chair those 2 committees and exercise white supremacy over a room full of Black elected officials and tell us you all aren't even going to get the vote. So I'm just giving to you as straight as I can give it to you. Do you understand what I'm saying?
I do.
Okay.
And
That's how
it's a
simple it is.
sad, but it's a sad day. It's a sad day. It's a sad situation. I think it's pitiful that, you know, that we aren't even given the opportunity to have a vote. And I wasn't everybody present. That's how serious it is to us. Why who is absent from a and to vote on some compound is that? It's not okay. And the people want to know, and the people will know who voted, who didn't, who's interested, who's not. I'm gonna keep it out there because we want body cams.
It's going to get to the point where, because it's white supremacy operating, it's going to get to the point where this story is going to eventually break nationwide. And people are going to be saying, well, that's how they operate in Delaware? Like, this story hasn't broken. This should be a national story.
Absolutely. Well, so when is it gonna, is it even gonna get back on the calendar for people to reconsider, or is that a no?
We're here all together today talking. You notice that the people who are holding this up did not show up at this meeting.
Wow.
They're not here. You know why they're not here? Because they don't control the mic. They don't control who's saying what, how it's being said, and they only can play if they can dominate. But on a fair playing field, they know they can't win, so they don't show up on a fair playing field.
So who is the person who can say, yes, this can go back on the calendar? Who is that person? Because I think then that's who we need to speak with. Is that the mayor? Is that the
President? Council President Hanifa
President
Shabazz.
Hanifa Shabazz, she controls everything that goes on the committees, even though they say the committee chairs do, except for this committee, and everything that goes on the legislation. That is my understanding.
No, you guys are leaving Bud Friel and Loretta Ross under our rules, each chair, just like Trippy put this agenda together. Loretta Walsh and Bud Friel are using their positions to dominate over keeping Black elected officials from voting.
Oh, I agree,
They are
but it
the
has
ones who set the agenda. Hanifa appointed them to those positions. But remember, you wrote to Loretta and she refused to put it on the agenda. Now, you can complain to Hanifa about her appointee, but I'm saying we can't sit here and tell the community that it's just Hanifa. It's Hanifa and the people she put in them positions to disrespect us.
I agree. May I say something?
Yes, Councilwoman Gray.
Thank you. I'm addressing this to the lady. I'm sorry, I forgot her name. But I think the best thing is to look at how the different council people vote. And I don't know what district you're in, and you don't have to tell me, but just look at how your district person votes or how the people at large have voted. And we're all up for re-election on September 15th. That's the only advice about how can we control this. We may not be able to control it this legislative session, but you need to look at who you vote in for the next session. That's the most important thing. And tell all your neighbors, all your friends to vote, come out and vote. But also try to educate yourself. You can go on, I think, Councilman Guy's Facebook page and find out who voted which way, or you can go back into the meetings, they're all online, and find out how people voted. That's the best advice I can give anyone in the community. Because otherwise we don't hear your voice. Not many people do what you do and patch into the Zoom, or either they get tired or bored because there's a lot of legislation that doesn't relate to what they're interested in. So I'm thanking you also for expressing your opinion and letting us know, letting me know that there is someone out there listening to us and trying to understand what we're going through. Thank you very much.
You're welcome. So again, I guess I don't know if my question, I hear Mr. Guy, and he gave me a lot of information, but who is the one person that I go to, the community goes to and calls to say, why isn't this on the, that's who I want to know. I don't want to know all, I mean, I guess it is a lot of people, but I need to know who is specifically the person we need to be calling and speaking to and emailing. That's who I want.
There are three people, Teresa. There are three people who can make it happen.
Okay.
There's the chair of public safety, who is Loretta Walsh. Chair of finance, Bud Friel, and then council president, Hanita Shabazz.
Okay, all right.
Ultimately, if council president Shabazz wanted it on the agenda, she could put it on the agenda. But the three of them are holding up the legislation.
Councilman Congo.
Yes, sir. Councilman.
If I can go. Also, once that happens and it goes into committee, all committee members need to be in attendance at the meeting to vote it out of committee. So once it gets on the calendar, they can play another game by people not showing up or having a quorum. So everyone on that committee needs to be there and be present, because our community wants body cameras.
No doubt. Okay. Well, I know that I have a lot of people who've been reaching out to me, inboxing me. You know, a lot of it's phenomenal, and it just speaks volumes. It's not just a district thing. It's a community. It's the city of Wilmington, and you know, a lot of people don't have the opportunity or the time or the know-how to get on the Zoom and have this conversation. So I will putting it out there, because we do vote our elected officials in, and when we do that, we expect in return the common decency to at least listen to why we want it, and then give us an explanation as to why we're not going to get it. Don't insult us and just not do it and not show up and think that it's okay, because it's not. So I will be making sure that we reach out to Mr. Friel, Ms. Walsh, and President Shabazz. I don't have a problem with them, but I do want them to know that there are voices out here that need to be heard. And I'm not the spokesperson for everybody. I'm not political or anything like that. I am just speaking from a community aspect that we need to make change, and change has to be today. We can't wait next year, next budget. We can't do, because I don't remember anybody asking us, did we want to change Rodney Square? I don't remember anybody asking us, did we want a new fountain? I don't remember anybody asking us if we wanted a new transit system. I don't remember us being privy to those conversations, and they happened. So, extend us the same courtesy of giving us what we asked for. We're not asking for a lot, but we will be. I'll make sure to that, because there's a lot of problems in the city, not just body cams. We got housing, we have a lot of issues, and we don't want to wait any longer. And again, I'm not political. I'm not out here to argue with people and who did what and all that stuff. I'm simply saying that there are a lot of voters in the city of Wilmington. And if we can be there for you when it's time to elect you in the office, it's time for you to be there for us when we expect you to cash in. That's it.
Thank you, Ms. Oliver. I'm sure all of us here really appreciate you for sharing your thoughts. If you're finished, I'm going to go to Councilman Sam Guy, then to Councilman Cyril Adams.
Actually, I am finished, but I'm at work, so I actually have to come off of this. I want to thank you for giving me an opportunity to talk, and I will be letting everybody know who we need to speak to.
Are you on Facebook?
Thank you.
Okay.
Is she on Facebook?
Ms. Oliver, are you on Facebook? Do you have a Facebook page?
Hello?
Do you have a Facebook page?
Did y'all hear me?
Hear us?
You didn't hear me?
Do you have a Facebook page?
Yes, it is Teresa. It's Teresa Oliver.
We'll keep you in the loop.
Thank you very much. Y'all have a good evening.
All right, thank you.
Bye.
Councilman Guy, did you have your hand up?
Yes, and just remember, there's a two-pronged approach. There's the existing legislation, and then there's the new piece Vash talked about and the new piece that I talked about. And if we have to go with the new legislation, then we can't send it to Public Safety or Finance. We have to send it either to the Personnel Committee or we have to send it to the Health Committee, since we just voted the other night that this issue of racism and body cameras and health issues are all connected. We're gonna have to do like Councilman Friel. When he didn't want his thing held up in one committee, he reintroduced it and sent it to his own committee. So we're gonna have to follow the whole process. We're gonna have to send it where it can be treated fair. We don't have to cheat. We just wanted to have a fair hearing, put it up for a vote, and either it passes or it doesn't pass. Thank you, Mr.
Thank
Chair.
you, Councilman Guy. Councilman Adams?
Yes, thank you, Mr. Congo. You know, I heard a lot of name calling, a lot of finger pointing with regard to legislation not being passed. But people have to keep in mind that this group is led by Councilman Samuel Guy. And if he's had that inability for getting things passed, maybe you need to consider a different leader of your group. And
We lost him.
Yeah, I'm not gonna allow. Can you guys hear me?
He's saying what he's supposed to be saying.
I'm not gonna allow that conversation to even continue.
The one thing I would like to say, Mr. Chair, is that everybody on this city council knows that there's not one person here that I ever asked them to vote a specific way on anything. And I'm not nobody's boss or nobody's leader. I just help with information when I know it. So he's got a misconception about my role. I'm a councilman like everybody else.
We're gonna go to Councilwoman Gray, and then we're gonna wrap up.
I figured you're about to wrap up, so I just want to thank you and Councilwoman Dixon for allowing us to have an open discussion, have some transparency, and I really thank the lady from the public because she allowed us to open the discussion up even more and hear what our constituents want. I wish more people would participate. I really would like to hear from more of the public and see if they support us or have them express their support of us so that the administration and these other council people that seem to be working against us and are a definite impediment will realize that they're also working against the city and the city residents. So I thank you for having an open committee meeting. And I hope that we can move forward and pass this legislation for body cameras. Good night.
I want to thank all of my council colleagues and I want to thank the public for Zooming and for tuning in. If you ever want to be a part of the Health, Aging, and Disabilities Committee meeting, please give us a call at 576-2140. Again, our number is 302-576-2140. Thank you, everyone, and good night.
Good night.
Good night.
Thank you. Good night.
Okay, good night.